Okay, so how chemical composition of the blood influences the blood pressure? So when we talk about chemical regulation, now we can write down sort of, look at this. So blood pressure is proportional to cardiac output multiplied by peripheral resistance. And cardiac output is kind of equivalent, look, to blood flow. Right? That makes sense? Cardiac output is basically a systemic blood flow. So, here's the outcome. When a patient has increased levels of CO2 or lower pH or lower levels of oxygen. Now think about this effect. Think about these three chemical parameters. What cells do with oxygen? What is the use of oxygen? When oxygen goes into the cell, like, why cells need oxygen? What for? It's a simple question, don't get me wrong, it's a simple question. Why do they need oxygen? To do what? So, go ahead. To work, and to work, what do they need? You making it way overcomplicated. Like, use of oxygen, what do we call the process in which humans use oxygen? Respiration, that's it, respiration. They use it for respiration, right? What is the product of respiration? Like real chemical product of respiration, one of them at least. Carbon dioxide, right? So normally in a balanced and homeostatic situation, carbon dioxide is promptly removed from the cells, from the tissues, right? Delivered to lungs and expelled in air. Now, if blood concentrations, systemic concentrations of CO2 go up, what does that mean? It means that blood doesn't move fast enough, so to say. Does that make sense? That for some reason we fail to remove that CO2. Okay? Now, another product, CO2, first of all, by itself, is a pretty acidic gas. On top of that, there's a lot of acid generated during the respiration, a lot of hydrogens generated, in the process of respiration, although it's a transient hydrogen. Lactic acid can be generated if we switch to fermentation. So what I'm saying is, again, active metabolism generates a lot of acid which drops pH. Does that make sense? And very, very active metabolism will decrease the levels of oxygen in the blood. To be said, this is the least important factor. Still is, but least important. Okay? That makes sense. So when systemically we have elevated CO2 or lower pH or lower oxygen, it means that blood doesn't move fast enough. We need increased overall blood flow. Does that make sense? And increased overall blood flow will translate into the increased blood pressure. Does that make sense? Is that clear? Now, there is some component to what we call so basically have this baroreceptor reflex, which is reflex regulation, which is discussed, renal regulation, which is discussed, chemical regulation. There is a bit of a more conscious regulation. Well, that's conscious, like when you start exercising and there goes direct sort of neural stimulation of the heart to increase the cardiac output and therefore increase blood flow and does increase blood pressure. There is some of it. as well, but not by much. Okay? Okay, so does that make sense? What I wanted to say, yeah. So that's it about chemical regulation. Now, since it's a pretty short video, I'm going to include 3 shocks, okay? So how about this? We're going to discuss the response to blood loss, okay? And then we're going to talk about the shock. So let's talk about blood loss first. Okay. By blood loss, I definitely don't mean things like, you donate a pint of blood and that's it. I'm talking about a wound. Wound that was inflicted, during a fight, for example. Okay. So blood loss means that blood volume decreases, right? Makes sense? Which leads to decrease in the blood pressure. We will try to kind of construct all together what happens. So, first of all, you've got increase in renin production right away, right? So this increase in renin production, I'm going to skip all the intermediate steps. Obviously, angiotensin will be generated, and eventually aldosterone levels will be increased, right? And that will result in decreased water excretion. Now, the words decreased water excretion, like if you will try to explain it to someone without any physiological background at all, how would you explain it? What would you say? Like, what the person will do less? Pee. Yes, you start peeing less, right? So don't pee as often. Now, another response that you're going to experience here, you're going to experience like a direct renal response. The one that we discussed previously when the amount of urine directly generated will be lower, okay? So again, decreased water excretion. So far, does that make sense? So think of it this way. Lower blood pressure, lower blood pressure results in lower blood flow. Okay? That makes sense? Through the kidneys. You can say that blood pressure is proportional to blood flow. That makes sense. So low blood pressure, lower blood flow. Lower blood flow, less urine is generated. Less urine is generated basically means lower water excretion. And then there's going to be another hormone, pretty interesting hormone, which you encountered before. Anti-diuretic hormone levels will increase, okay? So anti-diuretic hormone. Anti-diuretic means reduces the amount of urine produced, right? So that will also play into our conversation of reduced water excretion. And on top of that, listen, ADH has another interesting feature. Increased levels of ADH, they stimulate thirst, which is obviously a compensatory mechanism, you see? When you drink liquid, you at least compensate for the volume, right? I mean, red blood cells, eventually they will come. Okay, we good so far? Now, low blood pressure will engage via sympathetic system, and baroreceptor reflex. What does that mean in this case? So baroreceptor reflex. Your blood pressure went down. What's going to happen to the frequency of your cardiac contractions? What's going to happen to your heart rate? Huh? It's a response. Yes, yes. It's trying to correct the situation. So heart rate will go up, which results in the increased cardiac output, right? So look, all these responses here, decreased water excretion, thirst, they all are aimed at the correction of this. See that? So heart rate goes up, cardioacceleratory center is stimulated, okay? And by the way, cardioinhibitory center is inhibited. Okay, and your blood vessels are going to constrict, okay? Which means vasomotor center is stimulated. To kind of, we're gonna go like an overall through the overall summary, okay? Now the obvious question is, those blood vessels that are constricted, are all of them constricted? No, the least important ones. So it's going to be blood vessels in skin, digestive system and renal system. Makes sense, right? Good?
Why is it the least important?
Well, I'm kind of simplifying it. You can't constrict blood vessels across the board. You can't constrict blood vessels that supply blood to the brain. You can't constrict blood vessels that supply the blood to the heart. If you are, check this out, if you are in if I'm being wounded in a fight, I'm already in, so to say, sympathetic mode, fight or flight, right? I need muscles. So blood vessels in the muscles are not going to be constricted, at least severely, okay? But everything else, at this particular moment, kidneys, urinary bladder, digestive system, skin, are not critical. You see what I'm saying? So let's go over it one more time. So what we've got here? We've got lower blood volume, which results in the lower blood pressure. We lose blood, okay? Lower blood pressure will activate renin-angiotensin-aldosterone system, which reduces the amount of urine produced. Lower blood pressure will reduce blood flow through the kidneys, which also results in the reduced urine volume. And lower blood pressure will increase the amount of ADH produced, anti-diuretic hormone, which also results in the reduced urine output. Okay? It will result in thirst. And baroreceptor reflex will be engaged, which will result in the increased heart rate, okay? Blood vessel constriction, but blood vessels in unimportant locations. So in a person with a blood loss, what you can see, people are usually bluish, skin is bluish in color. Why? Because blood vessels that lead to the skin are constricted, right? They don't produce a lot of urine. Because of the lower blood flow through the skin, they will feel cold. Okay? So far, you following me? They will feel thirsty. And something that we didn't really really mentioned, but the respiratory rate will increase because they will need more, since reduced blood volume, they will need more intense oxygen exchange in the lungs. Okay, that makes sense? Now, if blood loss is timely stopped, then and if these people are not just led to their own devices, but if I lost some blood, I escaped from the fight and I come to some place where there is fluids and I just start drinking and I'm resting and I'm not bleeding anymore, and eventually I'm going to get back to normal, right? Okay. So what happens if somebody does not get, like if blood loss gets above a certain threshold, usually for an adult it's above 2 liters. So that results in hypovolemic shock. Okay, now look at this. Low blood volume results in low blood pressure. Low blood pressure results, among other things, low cardiac perfusion. By cardiac perfusion, I mean blood flow through the heart, which results in cardiac insufficiency. Basically, your heart, without a proper supply of nutrients and oxygen, cannot pump as efficiently. Does that make sense? Which, look what happens. It will feed directly into the lower blood pressure. Does that make sense? Clear? And it's kind of an interesting thing that what I'm going to try to do, I'm going to give examples of other shock just by simply writing the original sort of problem. So, cardiogenic shock. What is that? In cardiogenic shock, your heart fails to pump properly. Check this out. When cardiogenic shock occurs, basically it means that your heart can't pump with the vigor it's supposed to do it. Does that make sense? Which cardiac insufficiency will result in a lower blood pressure, results in decreased cardiac perfusion, which results in further cardiac insufficiency, and again you have a positive feedback. Does that make sense? So let's do like real clinical analysis. So hypovolemic shock. What can lead to hypovolemic shock? Give me an example. The simplest one. Massive wound blood loss, right? Another thing, by the way, what can result in hypovolemic shock? Hemorrhages, internal hemorrhages. And in many cases, in some diseases you've heard about, of course, who else would bring this up? You've heard about Ebola virus and other, hemorrhagic fevers. What happens in those diseases often, listen, your blood vessels become superpermeable. Does that make sense? And liquid component of your blood starts to leak into the tissue. You see what I'm saying? Another example of hypovolemic shock would be in diarrhea, when people lose large volumes of blood. That results in hypovolemic shock. So far, are you following me? And I think one of the most fascinating is circulatory shock. So listen, imagine that you have a patient with peanut butter allergy. Anyone has peanut butter allergy here? Hopefully not. Good, because anyway, peanut butter allergy. So this patient gets exposed to peanut butter and develops what we call an anaphylactic shock, right? One of the components of anaphylactic shock, now we're going to foray into some new uncharted waters. Yeah, listen, just put it down. You don't need to write this particular part down. Look what happens. When you have this allergic response, massive allergic response, not just in your nose or your eyes or your skin, everywhere, histamine that is released stimulates massive inflammatory outburst throughout the body. And a component of proper inflammatory response is vasodilation. When you have a local inflammatory response, say you have like nasal allergies, rhino allergies, you have vasodilation in your nose. When you have vasodilation of virtually all vessels in your body, like let's say all arterioles in your body, all of them are dilating, so diameter increases to a grandiose extent. What's going to happen to blood pressure? When blood vessels dilate, blood pressure is going to not just decrease, it's going to tank. It's going to drop. Okay? And what do we do when such thing happens to a patient? What do we do? What do we give them?
Antihistamines.
No. At this point, no. We give them EpiPen. We give them EpiPen. Because EpiPen, look, it will engage the sympathetic system. Okay? So it will rev up the heart and it will constrict the blood vessels that were just dilated. Does that make sense? So this is basically how this circulatory shock works. Clinical example, have you heard about sepsis or septic shock? In septic shock, usually it's a two-component situation, usually. Because in sepsis you have massive inflammation, which contributes to vasodilation and circulatory shock. And also very often you have a leakage of plasma out of the blood vessels into peripheral tissues, which will contribute to hypovolemic shock. Are we clear? Does that make sense? Cool.